Hi everyone, welcome back to the Navigant Credit Union Broadcast Center. I'm GoLocal News editor Kate Nagel. Thanks for tuning in for the 4 o'clock show. If you missed 3 o'clock, Laura Afonso kicked off today talking all things food locally. But we're going to tack to news and politics now. I'd like to welcome in Republican candidate for U.S. Senate, Bob Flanders. Thank you for joining us today.
Nice to be here.
I appreciate having you back in when you're breaking news. And the news today was a very healthcare-focused announcement from your campaign, focusing a lot on your opponent, Senator Sheldon Whitehouse, his support for Medicare for all, and how you view the healthcare system in the country moving forward, and why you don't see that as a good idea.
Well, first of all, it would be a disaster in terms of the amount of cost it would take to implement it. According to estimates, between $28 and $33 million over 10 years. So that would take up taxing the American public approximately 10% of GDP, $2 trillion a year. So $1 trillion plan that makes no sense. Plus, you probably have to give up your health care. Providers would have to take a 40% hit on their reimbursements, and the assumption is that they still provide the same level of care. So it's riddled with incorrect assumptions and so costly as to be impractical. It's really not a plan at all. It's just a political ploy. And even Senator Whitehouse, when he announced his support for this with Bernie Sanders, said, well, the details would have to be fleshed out. Well, they certainly would be.
And you talk about it being politics. Is this a populist approach? I mean, healthcare is really one of those pocketbook issues that hit people hard, and some harder than others. So, talk with us a little bit about that, about the Sanders proposal. Again, do you think the American public has a sense of what exactly this entails?
No, except that they, obviously, as you said, they're concerned about healthcare. There's hardly any more issue that's more important. We know that the ACA, the so-called Affordable Care Act, is anything but affordable, so we need to fix that. We know the Trump plan that was proposed didn't go anyplace. So it's obvious that we need a compromise down there. And one of the things I'm running on is trying to be a bipartisan guy who works with both sides, problem solves, and get things done. And so with healthcare, we need a plan that both sides can agree to, and we need to preserve the best parts of the ACA, but also inject more competition into the healthcare system so we bring down prices. Prescription drug prices are outrageously high, and we have the highest drug prices in the world. So I think we need folks who can work together. We need a plan that both Democrats and Republicans can support, and that's one of the things I'd be doing if I went down there.
So, of course, the makeup of Congress will be what it is after the elections in November with the players settled in place. But let's talk about the cost of prescription drugs. Folks know, even the average person knows about the influence that Big Pharma has on Capitol Hill. Do you think there is an appetite for bipartisanship to really approach this issue, or does money talk too much?
Well, I hope there's an appetite for, as you say, there's certainly a motivation, because we're all paying through the nose for these incredibly high prescription drug prices, and it doesn't have to be that way. We can free up the federal government, which has enormous leveraging power by virtue of Medicare and Medicaid, to bring down the prices. Right now, the government is handcuffed and can't negotiate by law to bring down those prices. So we need to free them up to do that. We need to have more transparency in drug pricing. We need an enforcement mechanism to go against these drug companies that try and put through outrageous price increases without justification. So there are a lot of things we can do to put pressure on that. And if necessary, I would even advocate buying drugs from Canada and other places. Let's get more competition into the system.
Reimportation. So is those really the linchpins of your talk today, Bob? The cost of prescription drugs and addressing, lowering them, and introducing competition. Is that really at the center of how you approach the healthcare crisis?
Well, the one thing that's missing there is it has to be bipartisan, because as you know, Kate, in order to get anything done in the Senate these days, you need 60 votes. So assuming that the Senate composition stays more or less that way, and of course that could change with the election, you're going to need 60 votes in order to get anything passed on health care. So it has to enjoy both Democratic and Republican support. So I want to go down there and work with both sides to come up with a plan that preserves what we like about the ACA, but also injects more competition and then brings down prices. Who can afford a $26,000 plan for a family of 4 these days? it's out of reach for too many people.
And do you think the failure of the Republicans to be able to broker something there, to the party in power to not even be able to make it happen, do you think that that's an indictment on, again, the hyper-partisanship of D.C.? We keep seeing it get deeper and deeper entrenched. I mean, is there a point in time where it stops?
I sure hope so, because I think we should go back to the days where we negotiated with both sides, and the whole point of the 60-vote rule is to ensure bipartisan support for bills. And when John Chafee was down there working with Claiborne Pell and others, there was negotiation that went on, and compromise took place, and that's the essence of legislation. So I think what was wrong with Obamacare or the ACA was that it was an all-Democrat proposal. And now, when Trump tried to put through his plan, it was an all-Republican proposal, and both failed in fundamental ways because of lack of bipartisan support. So my whole point is we need compromise, we need bipartisan support for a health care plan that's more affordable and that people will be able to access easier than they can now.
And so what do you have to say to those folks? General elections coming up in November. To those folks who might be supportive of Senator Whitehouse and say, I like what this Medicare for All has to offer seemingly to the American public. I know you just went through the litany of why you're opposed, but if you're talking to that voter right now who says, Bob, but I like this Medicare for All.
Well, are you going to like paying $32 trillion and the taxes that you're going to have to pay? Your taxes are going to go up at least 10% to cover this, 10% of the gross domestic product. Are you going to like having to give up your health care provider? Are you going to like having the government dictate to you when and how you can get health care? When this has been tried in other places, it's been a disaster. You have to wait much too long. You don't always have a doctor of your choice. It diminishes the freedom of the plans that you can have. It's the government saying, I'm here to help you. Really? How's that worked out? So I think there are so many things wrong with it, and I think it's unrealistic to think that it could ever happen. Even Senator Whitehouse, when he was joining with Bernie Sanders to propose this, said, not only do we have to work out the details, but it's unlikely ever to happen.
Well, we know what's in the details. It's
yes.
The devil.
Yeah, absolutely. And there's a huge devil in this one.
Well, again, you've had the big announcement today at noon. Was there anything that we didn't touch upon that you talked about today?
Well, the one thing I want to mention is that Senator Whitehouse and his colleagues enjoy what's called a Cadillac health care plan. So it's a little bit hypocritical for them to be proposing these things when they're not proposing them for themselves. Let's get the Senate, like everyone else down there, on the same page with the rest of America. I mean, I don't like the idea that there's some exceptionalism with the senators. They get to have the gold-plated plan, and the rest of us have to have deductibles and co-pays and all the things that we go through. What's good for us ought to be good for the Senate and good for Senator Whitehouse. Let's stop this, head in the sky stuff and holding themselves above the rest of us.
Well, I appreciate your coming in to talk with us a little bit about what you talked about today. We're going to get local with healthcare here in just a second with the former president of the Hospital Association of Rhode Island. But Bob Flanders, thank you so
Kate,
much
always a pleasure.
for taking the time to come in. Don't go anywhere, and you don't go anywhere. We'll be right back here in the Navigant Credit Union Broadcast Center.